Welcome, everyone. Today, we're going to hear about a really important program that brings nutrition and nutrition counseling to children through a school-based program. Co-interviewing with me today is my daughter, Shani Rosen, who is a licensed dietitian. And our guests are Professor Derek Kaufman-Shriki and Smadar Hod Ovadia. Welcome, everybody.
Hi.
Derek, could you begin by telling us a bit about yourself?
Yes, thank you for having me. So I am an associated professor of nutrition at Ariel University, registered dietitian and epidemiologist. My research focuses in nutrition and public health with an emphasis on chronic diseases such as diabetes, cardiovascular diseases, and multiple sclerosis, and dietary interventions. A part of that, I also lead a laboratory studying eating behaviors and try to focus on minority populations and cultural adaptations within the interventions I'm conducting.
Terrific. Smadar?
Hi, everyone. Nice to be here. I'm Smadar. I'm a registered dietitian. I am VP of Nutrition and Food Quality at Leket Israel, Israel National Food Bank. I have over 25 years of experience in nutrition, clinical nutrition, in public health, and many fields. Recently, I've conducted the clinical research study as part of my master's degree at Ariel University with Professor Vered about evaluating Leket Health Program, which we'll speak about. Thank you.
Very good. Very good. So let's get started. Vered, please tell us a bit about the needs. What was the background to this school-based intervention?
So in Israel, as we know, in other countries as well, the consumption of fruit and vegetable among elementary school children is generally low. And certainly below the national dietary recommendations. Now, looking at the specific Israeli food environment, although you would have thought that the prices of fruit and vegetables would be accessible to everyone, they're not. So one of our assumptions has been that the prices are a barrier for higher consumption of fruit and vegetables. And if we would use the food pantry such as Leket and provide households with fruit and vegetables, that would make the fruit and vegetables more accessible, and therefore children and their families actually would increase their consumption of fruit and vegetables. I don't think I need to speak more about benefits of fruit and vegetables because we all know how healthy they are and how important they are in humans' nutrition.
Terrific. Smadar, please tell us a bit about the program and what you know about how it's working.
So, Leket Health Program is a school-based intervention that combines rescued agricultural produce with health promotion. The program is operated by Leket Israel and is based on bi-weekly distribution of fresh fruit and vegetable boxes to families in elementary schools. Each box weighs about 12 kilograms and includes a variety of fruit and vegetables, along with simple recipes and informational materials. In addition, the program includes nutrition education activities delivered to the students and the parents together, and the school staff by registered dietitians. The key feature of the program is that the boxes are distributed equally to all families in the school as a part of a health promotion initiative, which helps to avoid stigma. In the research study that we have done, the intervention was implemented over 7 months among 3 schools in the city of Ariel. One school received the full intervention, the bi-weekly boxes and the nutrition education. One school received only boxes, the fruit and vegetable boxes, as a partial intervention. And we had a control group which received no intervention. At baseline, we've seen that fruit and vegetable intake indeed was low compared to the national recommendations. Nearly 78% consume fewer than 3 servings of vegetables, and similar proportion consumed less than 2 servings of fruit. It was interesting to see that about 2% reported that are not consuming vegetables at all, and 13% reported not to consume fruits at all, which relate to the fruit prices, as Vered mentioned. So we found in the research significant increase in fruit consumption. About the parents reported increase in fruit intake, and they proved it was significantly more common about parents within the two intervention groups compared to the control. We've seen that the use of the produce boxes was very high. Over 90% of the families reported to consume most or all the produce in the boxes. And we found that each additional box collected increased the likelihood of improved fruit consumption by nearly 7%. And about 2/3 of the parents reported to increase the variety of fruit and vegetables consumed in the household, which suggests that the program contributed not only to the quantity, but also to the dietary diversity of the families. I will say that beyond the research, the program is currently implemented in 10 elementary schools across Israel, reaching over 2,100 families. And the future is behind the corner. We want to expand, obviously.
That's terrific. Sounds like a really important and effective program. Could you please put this into context for us? Is this going on in other countries? Is this generalizable? What's the significance here?
In most high-income countries, I would say examples from Norway, France, even Korea and Japan, school-based interventions merely increase the consumption of fruit and vegetables among children, and those which did increase the consumption following an intervention, we saw exactly the same effect of increase in fruit only. So, for example, children in Norway consumed, if I remember well, 0.3 more portions, so less than half a portion of fruit following half a year intervention in which fruit and vegetables were supplied, like in our case, for no charge to the children at school. And the same happens with parents. If at all there is an increase in consumption following an intervention, in most programs have shown an increase in fruit consumption.
So is there something different about our findings, or they're similar to the findings from other
No,
countries?
similar.
Okay, very important. Okay, Shani, do you have any questions you'd like to ask?
First of all, I want to say this is an incredible program. Very, very cool that you guys are doing such important work. I did want to ask about the food chain. How do you make sure that the produce is good? How's the whole thing being managed? How does this financially work in terms of the farmers? So I would love to get a better picture.
Okay, so you're asking about the Leket Israel model. We are rescuing fruit and vegetables from farmers. Many reasons for farmers to donate the produce they grow. Sometimes it's weather conditions that damage the looks of the produce and they can't sell it. Sometimes it's the same type of fruit in the market and the prices are going down and it's not really pricey to sell them. So there are many reasons. We are working with about 700 farmers throughout the whole country, connected to them, as when they have fruit or vegetable that they want to donate, they call us, we come, we have teams, we help them to take it from the ground or the trees or whatever, depend on the type, and we bring it to our logistics center. We sort it with volunteers, and then we put it in the boxes, ready to send to the schools. We are doing it. We are looking at the quality throughout all the chain, and it gets to the families at the same quality that you buy it in the supermarket or you get it from everywhere else. So it's not that it's different that what we all use to consume. It's the same. There is issue of diversity because we don't control what we rescue. So it's not just the regular cucumber and tomato that people used to buy. So in the boxes, you can find kohlrabi, broccoli, cauliflower, beetroot, and we've seen that children get used to eat it while the exposure is during time. So they're getting used to see it in their plate at home, use it, and then eventually they change the whole nutrition and attitude towards fruit and vegetables. And that's where we're aiming to make the change with the combination of accessibility, allowing the accessibility and the knowledge, the nutritional knowledge.
Excellent. Vera, did you want to add something before we wrap up?
Yeah, I do want to tie into what Smadar mentioned about the variety of fruit and vegetables being consumed. As we know, nutrition education is part of education. So it takes time until we can see results of the consumption or the education to consume various and timely consumed fruit and vegetables in terms of seasonality. We know that one of the dimensions of environmental consumption is not only to reduce waste, but also to consume the fruit and vegetables on time in their season. They will be more nutritious and they will enhance variability in children's consumption, and that is a value in and of itself. We did see an increase in this project in the variety of fruit and vegetable consumed, and I also I assume it will decrease the neophobia, the fear from new foods that young children may experience. So to wrap it up, in terms of the overall effect or the effects that we can touch upon in this program, I think it's the quantity, the quality, and the variability of the fruit and vegetables that children consumed following this program.
Terrific. This has been a really great session. I want to thank you, Vered. Thank you, Smadar. Thank you, Shani. Underneath the video, you'll find links both to the Leket site in general, as well as information about this specific program. And really hats off to Leket for this really, really important project. Thank you all.
Thank you very much.
Bye.